Hi everybody, very warm welcome to everybody joining at Physio Edu Australia. Hi. So a very warm welcome to everybody joining us at Physio Edu Australia. So as this is our first live session, we'll be beginning very shortly with Dr. Deepali, and we are very privileged to have her today with us. Hi. Okay, so talking a little bit about Dr. Deepali right now, I'll be introducing you to her. So, Dr. Deepali is the founder of Homeopathic Fitness Studio and BeFit Pilates Studio. It is a fully equipped Pilates studio in India, one of the fully equipped studios in India. She's based in Pune and she is the Pilates Ambassador of India and Balanced Body Master Instructor, International Pilates Coach. So Dr. Deepali is going to join us shortly, and just a second, we'll be having her live soon. I think there's some technical glitch. Just wait for you for a few seconds. Sorry for the glitch. Dr. Deepali is joining us shortly. Hi. A very warm welcome to all the viewers. I am not able to get the request. We'll have to wait. Hi everybody. Hello. Some technical error. She's going to join us shortly. Hi, Dr. Deepali. How are you?
Hi, Harshita. Good, thank you.
Am I audible?
Yes, you're audible. I hope I am audible
Perfect.
too.
Yeah, you. Okay, so a very warm welcome to Physio Edu Australia.
Thank you. Thank you for having me today.
Yeah, it's a pleasure. It's a pleasure, ma'am. So basically, we are at this live here today to give people an insight about what Pilates really is. But first of all, I would like to ask you, as in, how did you get to this particular area of expertise? Since you're a homeopath, right? And I would just like you to tell us briefly about your journey from being a homeopath MD to a Pilates international instructor.
Thank you for having me here. Um, I'm MD homeopath, and my journey has not been less than phenomenal. Being a fitness fanatic, I had a chance to experience Pilates as a teenager, and it had my heart, frankly speaking. Destiny got me to do homeopathy and having the holistic mindset to heal people. I had my clinic running for around 14 years now, where we were, totally dealing people, patients holistically, meaning
Right.
animal medicine and lifestyle changes, where we were able to make a lot of changes, lifestyle changes, and cure for a lot of lifestyle diseases. But then,
Right,
um,
right,
this little puzzle was not complete. With
right,
Pilates, got totally complete when I traveled across and I learned Pilates from various countries. And here I am now with BFit Pilates, boasting of having fully equipped Pilates studio with an authorized training center from Balance Body. And me being a Pilates master instructor, my passion today is to make people fall in love with Pilates because it's been authentic and lovely exercise system which people should experience.
very true, very true. So, since Dr. Dipali, Pilates is not something very old that has come to India, it is something very new, I believe. And you know what Pilates is, I know what Pilates is, but a lot of viewers watching today actually want to know the basics of Pilates and probably an introduction to what Pilates is and how it started.
So basically, Pilates is a scientific exercise system which totally changes the way you sit, walk, and stand. So it makes you unlearn faulty movement pattern. Since I have a lot of physios over here in this live, so you'll understand when I say
Right.
that, unlearning faulty movement pattern and learning correct new movement pattern, so that you can have your activities of daily living with ease, efficiency, and economy. So when I say
Right.
that, it works on your postural muscles, on your stabilizers, rather than just the global muscles, which many exercise system works on. You see around so many exercise system which works on only global movers, but then Pilates is an
Very.
exercise system which emphasize on the stabilizers, joint stabilizers, to stabilize your joints, to have correct your imbalances in the body, to create balance in the joint, so that you have joint stability, you have a good posture, you have good core strength. Talking about the core strength, that's the crux, that's the essence of Pilates exercise, where we
Very.
start from the center, from the core. And then, there's a lot of element of control. So Joseph Pilates, who's the founder of Pilates, called this system contrology, because each and every exercise is so much controlled, so that you not only work concentrically, you work eccentrically also, and that's where you gain strength. So Pilates has a lot of emphasis on alignment and your posture and the way you're moving. So it's so much what I think physiotherapy also believes in and has the goals aligned. So I truly believe Pilates is an extension of physiotherapy. So where
For
physiotherapy,
sure.
Pilates starts, you can see that.
And okay, so now that we know the crux of what Pilates actually is. Now, since we have a lot of physiotherapists who have joined us today, and me being a physical therapist myself, I would really want to know from you, how can I use Pilates parallelly with my physiotherapy treatment in my daily practice?
True. So I totally believe that we all, as healers, when people come with pain to us, we strive our best to give a successful, positive experience for our patients in a safe environment. So that when they're exercising the good movement pattern, they feel safe and they feel confident, right?
Right.
So physiotherapy does is, I'm sure you guys know it better, but then it's a lot into physical manipulation and relieving stress in the muscles and giving them relief, pain relief. But then you can extend this further. You give homework to your client where you give mat exercises and stuff. But then we also know that, especially when clients are coming to you, they're coming with injury or they're coming with faulty movement pattern, to just tell them an exercise and make them do it at home. You're sure that they might be doing sometimes wrong, or it requires that supervision. So you getting a Pilates workshop like this for yourself will treat you with a treasure of repertoire, the richness of exercise that you will be able to, pass on to your clients with detail to precision, with detail to what you want to cue them, what you want to let them know, what they need to see, or maybe you can provide classes, private classes to your clients, which will not stop and say goodbye to your clients when you stop doing the physiotherapy part, but then it can extend further ahead. So that's where I truly believe that physiotherapists have a win-win situation with Pilates scenario, wherein your goals will be met, the kind of healer you want to be, you will be satisfied at the end of the day that you have really looked upon the cause of the injury or why the client is coming to you. So I think every therapist should definitely know and experience Pilates and learn Pilates so that you can pass on this legacy of Joseph Pilates, which is so amazing and so satisfying. The clients are going to be hooked to you, believe me. They're not going anywhere.
I'm sure, because what I understand is like we do treat patients with exercises and electrotherapy together. But I feel Pilates, along with it, if we can add it to their regime, it can probably provide a very holistic approach and an overall health to the patient. Like obviously continuing post physiotherapy treatment, I think it can really keep them fit and active.
Absolutely. So it also helps in developing strength. It helps in developing a good posture. It will help you develop good core strength, pelvic floor strength, which we as healers and a lot of people are not aware about this. So the core strength, the inner core unit, which we talk about, the transverse abdominis, the multifidi, the diaphragm, the pelvic floor, all of these together when they work, that's what we work towards in each and every movement. So research suggests that core is the first to fire before even when you want to lift hands or legs, or so that's how core is so much into your body and is the need. And what happens is people usually, when we live a life, we learn how to not fire the way we are sitting nowadays throughout work from 9 to 5, or maybe just less of physical activity or learning faulty movement pattern. All of this makes you not fire your core, and that's where your back pain, which has no reason, or maybe for any injuries happens, and that's where you can make them learn how to fire the core. So talking about the strength, the core strength, the pelvic floor strength. Then we talk about flexibility in terms of a range of motion. So we are not looking at crazy pretzel flexibility, not like a noodle anywhere that you're bending and doing stuff, but then which is going to be really applicable in your real life, in your daily life, like your range of motion, preserving your range of motion as you grow older. It also helps you in the other fitness components like your balance, your agility. You start to lose your balance and your agility after the age of 25. And Pilates not works on strength, mobility, and posture correction, but it also works on the agility, balance, coordination, reaction time. These all small things which are so integral part of fitness and is required as a prehab. So a physiotherapist who knows Pilates well is going to be a solid combination to tackle the problems of today's world. I totally believe that.
Yeah, perfect. And well, apart from the mat Pilates, I have seen some huge aesthetic looking equipments of Pilates. Can you brief us about what that really is?
Yeah, so definitely we have amazing equipments like reformer, trapeze table, chair, lat. So these all words are going to be like very foreign to you guys. But then you might have seen now that celebrities have made it to the Instagram with Pilates equipments and making it a trend.
Yeah.
So many people
Yes.
know what reformer,
Yeah.
what chair is, what trapeze table is, because you will see many people doing a lot of athletic stuff, which looks so fun. But then believe me, these all are, not only fun element, talking about the foundation movements. That's where Pilates starts. So, be you from any movement science, be you any trainer, be you anywhere working in field of movement, the
Right.
foundation like how you should squat, the biomechanics, the finer movements are taught in Pilates. So we start with
Perfect.
right what are the biomechanics behind squatting? What are the,
Okay.
of course, you guys also talk about and deal with. But then we deal with doing it repetitively till it becomes the second nature of our clients. So that's where
Okay.
Pilates stands.
Okay.
Educate and empowering them to have that knowledge, because mind only sees sorry, the eye see what the mind knows. So
Okay.
many people don't know that they are doing things wrong. So Pilates play an important part in empowering, educating them, and letting them know, because when they're aware they will correct it, and that's where we are.
Right, right. I believe that is some massive, massive chunk of knowledge we have gained from the very beginning of this live to now. And also, since now we know about Pilates, can you give us a quick insight about what is going to happen on the workshop that is being conducted in June regarding the mat Pilates?
Fantastic. So, yes, we are very excited about this workshop, which is going to be one of its kind. And we have not offered this anytime before. Pandemic gave us
Right,
a chance to do that. And many people across the globe from anywhere can connect to this workshop with ease of
right.
just great connection and having a mat. That's all you're required to do this workshop. And believe me, in this workshop, you'll be learning every nitty-gritties of how, why, often exercise, of when you're going to exercise. Not only that, but then you're going to learn various postures, how you're going to assess a body, what is there to change in a body, what
Right.
eyes are looking at. So we're going to sharpen your eyes to look, to scan through the body, to look at movement, different movements that need to be corrected in the body. And from there,
Perfect.
you being a physiotherapist, if you join in as a physiotherapist, that's going to be even more better, because you already know the body and you will be having an extra advantage over doing this course, because this is going to provide you with a toolbox of beautiful exercise.
Perfect.
All the mat exercises will be taught to you. So you will
Right,
be
right. All
in detail. Yes. So you'll be
that
learning
sounds
3 times. It's not only that you don't worry thinking that, oh, this is, online and virtual, and how can we learn
yeah.
something which is so.
That is definitely a point of doubt in everybody's mind that how am I going to learn something which is three-dimensional online in a virtual platform?
So that puts all, definitely it's challenging, and that puts us more of a responsibility. We need to put across how the exercise looks sagittally, how it looks currently, in every dimension. So that's what we are going to work towards. And that's why we have so much of a time, 15 hours, 5 hours each day, so that you understand well. And we are not going to leave you until unless you totally understand it and you have it in your body. Don't worry about that. So I'm very excited about this, and you as a physiotherapist, you'll learn how to apply it directly the next day to your clients in the clinic.
Yeah.
That's what you're going to
So
learn.
obviously, we actually practice hands-on on our patients is when we will really understand the essence of Pilates.
That's true.
Right. Perfect. So I think that has actually briefed us about Pilates, its basics, and how can physiotherapists actually use it in their daily practice, or probably anybody who's into fitness who can actually benefit from Pilates as well, right? So I think it will be great if we can have Dr. Ambarish, CEO and founder of Physio Eddie Australia, join us on the live with us. Yeah. Have him. Uh,
Oh, yeah.
Hello,
Hello,
Dr.
Dr.
Ambarish.
Deepali.
Hello.
Hello, Harshita. How are you?
We all are good. How are you?
I'm fine.
What time is it in
Okay, so
Sydney? Are you still up?
I'm still up. Yeah, it's around 11 o'clock. I'm up, but yeah, that's all good. Yeah.
Great. So here we've been talking about Pilates, all about Pilates, and definitely the workshop that's coming up in June with Dr. Dipali. So, do you have
Yep.
anything to say or anything to ask her about it?
Yeah, I think one thing which you have already addressed by the time I joined was a big question which was asked to me by many of the people who are looking to register is how would we learn it virtually, which Dr. Dipali has answered. Like, it's like a
Yes.
three-dimensional thing which you have to teach.
Yeah.
So that's one of the major things which the people wanted to know.
Concerned, I believe, yes.
Yeah,
People are
yeah,
concerned about.
yep,
But I think Dr. Dipali has almost ensured us that, there is something, obviously it is going to be her doubled hard work that is actually going to help
yep,
understand Pilates better, even virtually. And probably in the comfort of their zone, in their own personal space, right? Without the
yeah,
fear of
exactly. I wanted to ask one question to Dr. Dipali, which somebody asked me on the chat box below, is that we are doing this for 3 days, and that's around 15 hours, like for the total transcript hours. Where does a physiotherapist who register for this workshop take it ahead? Like, what is the scope? What is the future prospects of them doing it? Because they basically, as physios, I have been in academics for around 11 years. We don't have any curriculum for Pilates in the teaching sector.
yes.
We do know that people practice Pilates, but we don't have anything in the curriculum in no University of India, at least. And even internationally, I don't think anyone has Pilates in its curriculum. So if Dr. Dipali could enlighten us, like after doing the 3-day workshop, what future prospects does a physiotherapist have?
Yeah, so wonderful question. This you will see all across the globe. Uh, Pilates studios have in-house physiotherapists to work with them,
Yep,
because
yep,
physiotherapy is kind of a clinical setting, and having
yep,
therapy physiotherapy department in a Pilates studio is only going to help have more prospects of injured clients getting in and having been seen with a physiotherapist who knows about Pilates and taking it forward in the same setting with the same physiotherapist who knows Pilates. So basically what I'm talking about is you can either join a studio or you can have your own setup. Believe me, Pilates is very new in India yet. It's still
it is,
in
yeah,
the
it
stage.
is,
So
yeah,
we are pioneers of Pilates in India. And if you as a physiotherapist, if you take over to Pilates, it's only going to make your practice richer, believe me. 5 years down the line, having experienced Pilates and having to teach it, you will find yourself at a place, at a top-notch place than other colleagues. And you can yourself experience that. We'll be through this workshop, you can do that. But then you should try Pilates and see for actual what it offers. You will not be regretting at all, believe me. You'll be at a
Yep, that's
the kind of offerings it has, and especially to
yeah,
a physiotherapist who is invested chunk
yeah,
amount of time in learning the human body
yeah,
biomechanics. It falls
yes,
in laps of physiotherapist to take it forward
yeah,
and
that's
make a booming career out of it. A lot of
yeah,
people nowadays are looking to continue with Pilates because in fact myself, like we have so many people who have been gymming for years together,
mm,
who've been gymming 2 years together and come and experience Pilates, and they are taken aback. They're like, where was this? I've never felt this way before. And kind of,
yeah,
but then people with pelvic floor dysfunction and incontinence and, breathing problems, a lot of things are going on in today's world, which there is a big gap, which, Pilates is here to fill. And it's up to you if you
yeah,
pick it up as yourself to, preach
yeah,
in a way wherein you're halfway there being a physiotherapist. So,
yep,
it's a win-win situation if a physiotherapist enters into this exercise system. He's only going to find his
yeah.
notches up. Very true.
Yeah, it's something that I think in 2021 we have an idea roughly of how it's going to grow in terms of the fitness industry or in terms of the physio industry. But many of us don't have an idea of the leaps and bounds it's going to grow in the next 5 or 10 years. Like, another one question which was asked to me by a few people who are looking to register is how practical and how expensive is it to start a Pilates setup? Like they have seen images on Instagram, on your page. They have seen images on Balanced Body, on the official website, including the Balanced Body Instagram page. A few things look sophisticated. And for a person who's starting in his or her setup, or even having, say, 5 years of setup clinical practice, sometimes getting that amount of clinical space is a sort of challenge, both physically and financially as well. So, how would you like to advise them with regards to the space and the costing?
This is the question which comes next once a person seriously thinks about doing Pilates because,
Yeah,
yes, for a matter of fact, that it is expensive with the equipments.
mm,
Yes, it requires space. But then only if you're looking at building up a studio. Believe me,
yep,
so many successful and more busy mini studios, like you can say somebody who's having a reformer at the place itself, a clinic.
yeah, yeah,
You will see on my page, if you go on Instagram, you will see the
yeah,
reformers. So that's what we are talking about. Even if you have one of that is going to be
right,
amazing to transform your clients. Your clients are going to be hooked to you. They're not going anywhere
yeah,
again, because the kind of feedback a reformer will help you achieve to your clients
yeah,
is going to be totally different, because you'll be able to access muscles and movements that you never could access without that equipment. So definitely it is expensive, but it starts slow, and you will yourself see that you will have the impetus to grow more. So start slow.
exactly.
You can ask me for further, helping you out in setting up the studio. No problem. I'll always be there if you want, if you need any help. But then I would say
Yeah,
it's going to be amazing investment, and the return of investment is amazing, because
it's in the
when you start, you are not going to say goodbye to your clients like how you do for your
yeah,
therapy and only let them come back in when they have other issues. So you'll be dealing
yeah,
with your clients every month, every single day for years. In fact, they will never.
for years.
They would want to speak to you and be coming to you every alternate days or twice a week, depending
Yeah,
on how you're going to call them. So believe
yeah.
me,
Right,
not
right.
Mac Pilates is just a start. Once
Start.
you can get into equipment Pilates, which is like reformer Pilates and trapeze table.
Hmm.
Uh, take you to another level, because you will
level.
so much powerful to address their issues, which you cannot by. So understand this, that just by physical manipulation and relieving the muscles and their problems and giving them, teaching them good movement patterns, that's what we as physiotherapists do. But then Pilates is going to take it
Right.
forward, let them come back to you and do
Back to you.
continuously till it becomes their second nature. So
Exactly.
teach a lot of clinical Pilates, and we deal with a lot of
Yeah.
back issues, we deal with knee issues, with spine, with muscular
Yep.
issues, peripheral muscular, your hip replacements, knee replacements, all of these, your
True.
ACL tears, all of these are
Yeah.
phenomenal. The way it works, Pilates,
Right.
you'll have a
Yeah.
little exercises.
I think you can
And
say
also, I believe since we are offering, I mean, Dr. Dipali is being kind enough to offer us a free Zoom session
Yep.
to introduce Pilates to us. So that is a real boon, I think, to everybody who has
Yep.
joined us right now. This is a piece of information, and for this, like for to join this, actually, you can DM us, okay, and we will be sending you a WhatsApp link where you can add yourself, and we will be soon sharing details for the free Zoom session held by Dr. Dipali.
Yep. Yep. That will be nice. I think there's also some Pilates classes which Dr. Dipali takes thrice a week. So how does that work out, Dr. Dipali? Like, what are the main clients who come to you? Like, are they from the fitness industry, or they are just a common man, the common person?
So basically, the classes which I teach, usually these are mat Pilates classes in the morning. I just teach one class for mat Pilates,
Yeah.
motor class. So motor again is an equipment which can easily be taken anywhere. You can do Pilates on a go. So maybe next
Yeah.
or sometime later we would talk more about motor and other equipments. Right now is not a good time to talk about that. But then I do a
Exactly.
equipment classes, and online we do this online, so we rent motors,
Okay.
and many people all over India join us in that motor class. The best thing, or what I can say, pandemic did to us was to connect us,
So virtually.
see where we are
Right.
today. This also would not possible if we were so busy juggling our life, never stopped by to see that we can also over here. So yeah, this is what, so the same way, I'm doing mat Pilates classes in the morning, 8 to 9, Monday, Wednesday, Friday.
Mm-hmm.
And this is open for general population. These are not for
Yep.
at sharing any knowledge, but then definitely to
Knowledge.
experience for yourself, to get an experience of
Yeah.
what it is, and to
Yes.
see how it transforms your body, because they say do Pilates, in 10 sessions, you will feel the difference. In 20,
Yeah.
see the difference. In 30 sessions,
Yes. Exactly.
people will see the difference. So you will yourself
Yes.
experience that. So if you want to
Yeah.
join that, that's the only batch that I
Yeah.
teach, 8 to 9, Monday
Right. Mm-hmm.
on Zoom. And
So, now there's a
Pilates also will
sorry.
Tuesday, Thursday, Saturday 9, which we rent the motor. We have limited number
Yeah.
of motors, and we rent people even across cities. We can fit it if anybody wants to.
Do it.
Yeah.
Yeah, we can share the details for the same after this session. Yeah. Yeah.
There's a question asked about SI dysfunction by Divya. How does Pilates help? And I think a part of that question is already answered by Dr. Dipali, saying that basically we are working on the core muscles. So Divya, when you're working on the core muscles, obviously you're working the synchrony with the abdominals and the back extensors. And SI joint dysfunction is caused by an imbalance between these two set of muscles. So as what Dr. Dipali said, when you're working on the core, it's going to be one of the main things which is going to take care of SI joint dysfunction. Obviously, there'll be some physical manual work which you need to do for the SI joint, but in the end, the long run, the ultimate answer is core for everything. So whether it's the back or whether it's the hip,
I'll
whether it's
fire up.
anything, whether yeah. In fact, when I was working in Pune for 12 years, and I knew Dr. Dipali since then, 2008 or 2009, we have a very famous shoulder rehab protocol from a very famous surgeon, orthopedic surgeon, run in Pune, which is called as the Pune Shoulder Rehab Protocol, PSRP. Now it's a shoulder, but the doctor in his protocol has entire core strengthening in it. So yeah, it is core. So it's not only of the back, it's about the entire body. The ultimate answer is the core. So when you're working on the core, you're going to take care of most of the issues which our body is facing. So SI
We do
joint dysfunction is no
have a
exception.
important question, and there's this AR physical therapist who's asking any contraindications for Pilates.
So, contraindication for Pilates. Absolutely, you learning Pilates, you will be in the position to well answer that, which exercise you're going to give to which people, and that's what you will be at the place to answer once you learn Pilates.
Yep.
Because you cannot have a contraindication. Of course, what you mean, I think, is that a lot of exercises are there in Pilates, and you're looking for that kind of an answer. But then let me tell you that that is more of a traditional mat Pilates class, which is meant for general population. But then you, as a
Yeah.
physiotherapist, once I show you an exercise and what we're looking in that exercise, you'll be able to extract even more knowledge, and you will be able to apply it clinically in your clients, your flexion-based clients, your extension-based clients, whichever clients you have according to your condition that you're dealing with. So treat the body in front of you. There are no contraindications to Pilates. Everybody falls in.
Yes.
As you said, it's a low impact exercise, and anybody in any age group can actually do that.
That's
One major thing I would like to point out is, like, being in a clinical physio practice for 12 or 13 years now, is as a physio, we get referrals in India. I mean to say in India, I'm not talking about Australia. Things work very different here in terms of physio. Here, patients or clients come directly to the physio. They don't go to the GP here. Whereas in India, unless things have changed in the last 4 years, which I'm not too sure,
That's important.
uh,
We do get
yeah,
that.
it is. Yeah, the maximum of the referrals do come from the orthopedic surgeons or from the doctor. So when you have Pilates incorporated into your actual practice, I think it's not only the patient, it's a person who wishes to be fit can be your client. Whereas if you're doing your basic conventional physio, you basically will only have a patient come to you. You can't get a regular client come
Very
in
true.
for, say, two sessions a week or 3 sessions per week or even one session a week. So when you're doing Pilates or you're doing something which stands out in the market, you must be thinking that it involves a bit of time initially to be involved. It must involve a bit of money into it. But in the long run, you will be converting your clients, your not so patients, means who are normal, into your futuristic clients all the time, which is very different as compared to just doing a conventional electrotherapy in physio, which over a period of time, I'm sure most of us just get fed up of it. Like, you say, what are we doing? So that is one major difference which I would like to point out.
absolutely. I agree. As a therapist, you'll be just right spectrum. Normal general population will also want to come to you because you being a physio, you already have the tag of physio doc.
Yeah.
You being a doctor, Pilates is gonna have you again at a level when you would want to come to you. Sizes, you can run, you can have successes. You can contact me if you have any questions about it later on in DMs. But then, believe me, you are joining now. You're going to be amongst the pioneers of India, and you will be soon, experiencing the benefits, and you're going to witness how amazing your career is going to flourish.
I think that's what Dr. Harshita already pointed out, is like all the ones who are here and even the ones who will watch this video when we upload it, it's the best thing to do is try the free class which on Zoom, which Dr. Deepali is going to give. You can obviously progress from that to get registered for the 3-day workshop. And I don't think the fees or registration is anywhere close to what you're going to get from it. It's like the investment which we will get for that will be a long term. So, and once I can assure you guys is once you do the 3-day workshop, you will definitely ask Dr. Dipali is how can I register for the first module of the actual thing from balanced body, which is the actual core concept. Like if anyone wants to actually go straight into that, they can also contact Dr. Dipali and us with regards to that. Like it's a 4-module thing, which we have shared the information with everyone. Total period of 8 days, I guess. Yeah.
One thing I want to highlight that when you're doing certificate course, you are at a level where it's a recognized certification all over the country and looked upon certification. Body is the one of the highest educator of around globally, and there's so much of a demand for Pilates, comprehensive Pilates teachers out of India. If
Yeah.
thinking of shifting anywhere, may it be, US, Australia, New Zealand, anywhere, Singapore,
Yeah.
Switzerland,
Yeah.
everywhere they have so many, inquiries, and they need a good Pilates certified instructor, a comprehensively
Yeah.
instructor. And you being
Yeah.
if you apply, believe me, you'll be surprised at the pay you would get out of India too.
Yep.
So,
Yeah.
yeah, there is a lot to ponder about getting into certifications, which is going to give you an international certification, which is going to be like, totally a game changer, and
Yeah.
gonna be for lifelong. This is not a subscription-based certification where you're
Yeah.
renewing and keep having a hole in your pocket. Yeah, it's just one time.
No, it's just one time.
You're good to go and
Right.
having that throughout your life.
Now, Dr. Dhaval, who's a good friend of mine, he's asked a question saying that can we have a case report being shown or presented? Yeah, that's actually a good point, Dr. Dhaval. Like I think maybe from the next session or even after this session, you will share a few articles in which Pilates has been incorporated into a setup and the results have been given. So I can definitely look forward to getting a series of articles, maybe from India, or maybe from abroad, and we can send that through to everyone who's here. That can be done. I think that's a very good insight so that people basically have some sort of a reference that how effective Pilates has been as per research.
So you can also
Right.
Yeah,
go ahead, and that's what informally all over my Instagram, sort of videos
yeah, it is.
on my Instagram, and you can go on will be with Pilates reviews over there also. Most of them how they have benefited after visiting a lot of doctors and being at a lot of physiotherapist clinics and being to chiropractors, how Pilates help them. So you read it for yourself, and if you feel like connecting to any of my patients and clients, I'll be happy to get you connected and have that experience firsthand.
Also, there is a very interesting question. I believe a part of it is something we want to be aware of. That can a prenatal, postnatal, or a pregnancy physiotherapist actually practice Pilates with the patient?
Absolutely. So as I told you, totally stresses on the inner core unit. So the strength of the core, where your diaphragm, your transverse abdomen, your multifida. So definitely we are dealing with all these, vertical, your horizontal floors. So being a pre and postnatal physiotherapist, totally gonna give justice to your clients in terms of pelvic strength, and you should also know that Pilates is absolutely safe and prepares a woman to give birth, because the kind of breathing practice, kind of muscle, strength that we develop totally gets you ready to give birth. And postnatal also, talking about the diastasis recti, where we are targeting only the transverse abdominis mostly, and then talking about various other pelvic floor issues, dysfunctions. Pilates is the answer, I would say.
So, yeah.
I think that sums up Pilates, and it you have like given us some really massive knowledge, and I think we all are in a better position to understand Pilates now. So thank you so much, Dr.
There's one
Deepali.
question. There's one question which just popped in right now. I think it's indirectly related. How will Pilates help in avoiding degeneration of my backbones?
When
So basically, question the arthritis. How do you prevent? Yeah.
Pilates and how I can talk all day. And this question definitely hits at the right spot because Pilates is totally, it creates space in your body. So when I say that is the principles of Pilates are so you work from center, you work in two-way direction. It's always constant, your body. What age does to us is it reduces the space of our body. So what is degeneration? Degeneration is usually when you have reduced the space and where you have compensated it with faulty, or less strengthy muscles around. What Pilates does is it helps to create space in these joints and strength to maintain that space. So that was Pilates does to you. It works, again, I repeat, it works not only on global movers, it works on
Yeah.
stabilizers. So when I say it works on
Stabilizes.
stabilizers, it works on balancing out muscles. So it doesn't work on favoritism like more of quadriceps, less of hamstrings. It'll work on both sides so that you have a very happy and healthy joint which is going to last you lifelong without you having to worry about the degeneration, because as long as you
Generation.
muscles balanced, as long as you know the
Mm-hmm.
correct movement pattern, as long as you keep the motion is lotion, you're good to go.
Yeah. That's a very famous term which we use it here. Motion is lotion. We got to say it every day almost to all our geriatric clients here. In fact, this is a question which has been asked by Dr. Hetal, whom I know well. She's asked like, can we use Pilates in geriatric populations? Because she deals with a lot of geriatric populations in Pune. So if Dr. Dipali can take it, I think it's related to the same. She's asking if she wants to incorporate Pilates in geriatric patients. How does she go about it? How safe is it?
So let me tell you, Pilates is a very low impact. Being low impact doesn't mean it's not effective. It's highly effective. Generally, if you think about impact, it's thing or, but then you see with Pilates, the attention to detail is like fully, your whole body's going to work. So you're going to be, it's very highly effective. And we can safely practice Pilates from 9 years to 100 years. So when I say 100 years,
That's the
talking about people course from the later part of life where you really want to have an erect posture, to not slouch down, to not get compressed in your
yeah.
joints, to have good balance. Here is where your agility comes into picture, your range of motion comes into picture, your healthy joints
Yeah.
comes into picture, the way your flexibility is, the way your posture is, the way you keep moving. That's going to help. And a lot of times, like small things like your toe extensions, your dorsiflexion of the foot, your balance, many things are contributing. Because you age, there are a lot of things that you lose in the process. Majorly your end range, lot of things, your legs, a lot of things we lose as we age. And Pilates
Each.
comes to our rescue when we pediatric population. So as I said, it can be used. So let me tell you, I'm not tell you about this, but then Pilates was born when Joseph Pilates was captive in World War One with his inmates, and these inmates
Okay.
were the injured soldiers who were lying in the bed all the time, and he was like a ward boy running around and taking care of these injured soldiers. So he was feeling very helpless when he couldn't see them suffering. He wanted to do something for their wasting muscles because they were all be trained and they were wasting muscles. So he pulled up some springs, he pulled up some handles, some, thing to hold and pull their legs up and down, for their hands to go up and down. And he stressed the importance of breathing. So what they found out was that these soldiers were much more stronger than what they were before they got injured. These were the Nazi soldiers. So Nazi got to know about this detail, and he was behind Joseph Pilates to teach
Joseph
his
Pilates.
soldiers. He's had nothing to do with Nazis. So he literally flew away to US, to New York, to go ahead and get his own studio, where he had a lot of elite actors and dancers coming in for the workout. So that's how Pilates was born. So you see, right from rehabilitation to athletic,
Yeah. Yeah.
the whole continuum you can with Pilates. So when you talk about children, yes. Posture, yes. You can do workshops
Yes. Yep.
for making them aware about posture. Because nowadays, everybody's online and has this hunched posture with neck forward.
Yep.
You see how vulnerable it makes your spine, your neck, your hips, everything, you know. So look at that, what we're teaching our children to do. So Pilates, again, can be the backbone of teaching them good movement patterns with them lifelong and not make them enter any faulty movement that's going to be the reason for injury. So you see, not only students, not only children, you can go to teens, you can go look towards to working women, to childbirth women, to working men 9 to 5 who sit all day long and create flexors, who need to balance out their hip muscles. Everyone. So it is for everyone who's the one who's pigeoning forward, looking into their laptops all the time down to correct that postures. And to everyone, every single person, I would suggest that Pilates is the answer. Of course, there are a lot of system which goes along. You can do gymming, you can continue every other exercise, but then try
Yep.
and at least do twice or thrice a week Pilates, and that's gonna sort your other things. You're gonna be more better at doing other things.
That is perfect.
That's perfect. Yep. I think we've answered most of the questions which have come through. If Dr. Harshita wants to go ahead
Yes.
with the closing.
Perfectly. I think now we can conclude this session, and we have, I think Dr. Dipali has answered everybody's questions
Most of the
really,
questions. Yep.
and I think they all are very clear about whatever it is. And I would request you all, if you have, we have to cut this down now. We have to end this live session. If you have any question, you can DM us on Physio Australia, or you can directly DM Dr. Dipali on her page. And it was really nice having all of you. Thank you so much, Dr. Dipali. It was a wonderful live with you here.
My pleasure. Thank you, Dr. Amrit.
Thank you. Thank you, Dr. Pali.
And I'm very excited, looking forward for the
Yep.
workshop where I'm
For the
sure
workshop.
a lot of physiotherapists would be clear and join in. And look,
Yep.
thank
Perfect.
Thank you.
Thank you so much, Dr. Ambrish, for joining us.
Thank you, Dr. Harshita, for hosting this.
you. Yeah.
I think we'll end this now. Yeah.
Yep. Thank you. Bye.
Bye.
Bye.